Hello everyone, and welcome to UCSF's Lung Transplant Education Session. First of all, let me congratulate you on receiving your lung transplant. We know this is an exciting time for you and your family. However, we also know this can be an overwhelming time as you prepare for your discharge from the hospital. As such, we've created these educational videos to aid you as you transition into your new life as a lung transplant recipient. The first few months after transplant can be challenging as you recover from the surgery, as well as adjust to the new regimen of medications. There are lots of changes that you will undergo, and you will undoubtedly have numerous questions. We created these video education sessions so that you and your family can start to understand what life after lung transplant looks like. You will have many opportunities to hear this information, whether it's through your nurse coordinator, with your pharmacist, in clinic, or with other team members. This information will be repeated time and time again. In devising our educational model, we created 4 separate modules which you will view in complete detail. We took the 10 most salient points and created what we affectionately call the 10 commandments of lung transplant. In general, if you live your life by these 10 rules, you will be doing okay. I'll run through each of these before we dive into the details of the 4 separate modules. The 10 commandments of lung transplant. Number 1, always call your transplant coordinator when experiencing any symptom of infection, including fever, cough, extreme fatigue, or shortness of breath. Number 2, always wash your hands after using the bathroom and before eating. Avoid touching your face with your hands. Number 3, always wear a mask when you come to the hospital, to the lab, to a doctor's appointment, or in any crowded environment. Number 4, always take your medications on time and have your lab work done at the times instructed. Always call your transplant coordinator if you go off of your daily schedule. Number 5, always adhere to your surveillance and lab schedule. Surveillance is how we monitor you for rejection, and you will always be at risk for rejection. Number 6, always avoid exposure to smoke, dust, moldy environments, and respiratory irritants. Number 7, always avoid exposure to the sun. Wear sunscreen and protective clothing anytime you are outdoors. Number 8, always call for medication refills well before you run out of medicine. Number 9, always avoid ill contacts, even if they are related. And number 10, always bring your blue medication card to clinic. You should always bring your blue medication card to any medical appointment you have, including your primary care provider. Hello, and welcome to Module 1, Infection. Before I start, I want to make sure everyone has a sense of the body's immune system. The immune system is designed to fight off foreign invaders. Because your transplanted lungs are foreign tissue, we don't want your body's immune system to attack it. So we give you powerful drugs to keep your immune system suppressed. While this is helpful and necessary, it also limits your body's ability to fight infection. And this will be true for the rest of your life. Typically, we think of viral and bacterial infections as the most common, but we have also seen fungal and parasitic infections in our recipients. Infections can occur anywhere in the body, including, but not limited to, the respiratory tract, the digestive system, the skin, and the central nervous system. When we think about infection, we focus our efforts on prevention. For everything you do from here on out, you'll need to consider the risks versus the benefits. And no matter what you choose to do, you should always protect yourself first. Hand hygiene is the cornerstone of our defense. You can use hand gels, foams, wipes, and of course soap and water. Be mindful of things that you touch that you might not previously have thought of as a risk. For example, car keys, doorknobs, cell phones, and utensils are now all potential vectors of transmission. Avoid touching surfaces that may not be regularly cleaned. Avoid touching your face. Do not reuse tissues and do not reuse handkerchiefs. Avoid cleaning moldy areas like the bathroom, litter boxes, animal cages, and fish tanks. Wash your hands after petting animals handling money, and touching dirty objects. Finally, do not change the diapers of children who have been recently vaccinated. Besides hand hygiene, the second most important preventative measure is to avoid sick contacts. Avoid anyone who has been sick recently, even those with a common cold. If someone in your house is sick, both parties should wear a mask and be diligent about the prevention measures above. Avoid crowded environments if possible, and if not, then wear a mask when you are within arm's distance of each other. Always wear a mask when using mass transportation, buses, planes, and trains. Be smart about when you are going to be in crowded areas. Try to pick off-peak hours for dining, shopping, and traveling. For example, don't go to the new release of a movie on a Friday night at 7 p.m. Go on a Tuesday afternoon. And try to go to restaurants earlier rather than during rush hour. In addition to prevention of infection, you should avoid environmental irritants. The lung is a unique organ in that it is the only solid organ transplant that is exposed to the outside world. Avoid dust, smoke, cleaners, construction areas, and fireplaces, as these things can irritate the lungs. Another area of particular concern is gardening and plants. The soil is full of fungus, and any type of repotting, tilling, or soil manipulation can aerosolize the fungal spores. This could have potentially disastrous effects on your health. In general, we say that it's okay to water plants in the garden, but you should avoid doing anything further and avoid contact with anyone who has recently done so. If your family or friends have recently gardened, they should change their clothes and ideally shower prior to coming in contact with you. Regarding food safety, refer to the tab for nutrition in your binder. But in general, avoid all foods that are undercooked or shared. All meats need to be cooked well done. No sushi. Avoid salad bars and buffets, and even potlucks can be dangerous if the food sits out or is undercooked. It is impossible for us to cover every type of activity that our patients may want to do. This is why we stress the importance of prevention strategies. Again, the main principles are understanding good hand hygiene, wearing masks when appropriate, avoiding sick people, and constantly maintaining an awareness of where your risks are. In no way do we wish you to live in a bubble, afraid to go out and enjoy life. We only want you to employ strategies to protect your health. Most important, always remember, any symptom, no matter how small, should not be ignored. Early recognition of infection leads to early treatment and can help preserve the integrity of your new lungs. It is up to you to alert the lung transplant team of any new symptom.
Today we're going to be talking about rejection. Before we get started, to help make sure everyone is on the same page, your new lungs are recognized by your body's immune system as foreign. Your body will always view them as foreign and will always try and attack this foreign tissue. We give you medications to suppress your immune system in an attempt to help prevent this process, called rejection, from happening. I want to pause for a minute and just say rejection is a scary term and it can elicit a lot of fear in patients and families. Rejection is not a heart attack, it is not a stroke. You don't develop rejection and immediately die. It is a slower process, usually building over days to weeks, can be asymptomatic, but most patients feel run down, almost flu-like symptoms with hypoxia, low oxygen levels. There are two different types of rejection. The process I just described above is known as acute rejection because it develops acutely, days to weeks. It can occur at any time, but most commonly in the first year. This is why you're on the most immunosuppression right after transplant, and as time goes on, we decrease it. A second, more difficult type of rejection is chronic rejection. As the previous form develops in days to weeks, this process develops over months to years. It's a slow destruction of the lungs until they are no longer functional. This isn't easily identified or treated. Where acute rejection can be managed by just increasing your immunosuppression, giving steroids and reducing the attacking cells, chronic rejection doesn't really have any strong treatment options. It develops over time from repeated insults to the lungs. recurrent episodes of acute rejection, GERD, where stomach acid can come up your esophagus and go down into your lungs, and viral infections are some of the causes of chronic rejection developing over time. As we have discussed in this lecture series, prevention is key. So how do you prevent rejection? Follow your laboratory, medication, bronchoscopy, and clinic appointment schedule. We use all these diagnostic measures to determine the functioning of your new lungs and help prevent rejection. Do your best to follow the methods of prevention discussed in the infection lecture to avoid getting sick. Finally, even if you've never had reflux disease or GERD pre-transplant, we strongly encourage you to prop the head of the bed up so that your head is higher than your feet. This cannot be done with pillows, but can be done with phone books, cement or wood blocks under the head of the bed frame, or a device called the MediWedge. This will help prevent your stomach acid from leaving your stomach and going into your lungs while you're sleeping, when most silent aspiration occurs.
Hello again, everyone. Welcome to Module 3, Self-Monitoring and Personal Responsibility. In general, we think of three main parties who are involved in your lung transplant. Each party has a role in caring for these lungs. The first party is the donor family. They gave the gift of this donation and thus completed their part in the process. You, as the recipient, chose to accept these organs, and we will go through what is expected to maintain and care for these organs. Finally, UCSF chose to accept these organs for you, and I will illustrate how we monitor the ongoing health of these lungs. As the recipient, there are going to be several vital signs that we expect you to record. You will have to record this information frequently in the coming months, but over time, it will be less intensive. But you will always be expected to check the following information periodically. Blood draws. Upon discharge, you will have your blood drawn twice per week on Monday and Thursday mornings at 8 a.m. All of the lab orders will be in place, so there is nothing for you to bring. The key is that you should not take your medications before having your blood drawn. We are checking blood levels of your medication, and it is important that you do not take your medications beforehand. However, it is imperative that you bring your medications with you, and as soon as the phlebotomist completes the blood draw, you should take your morning medicine right there. Again, please do not take your medications before the blood draw, but please take all of them as soon as the blood draw is completed. There are several items that you will need on hand to play your part in this process. These include a blood pressure cuff, which usually includes a heart rate monitor, a thermometer, an ID bracelet, and a weight scale. Finally, you will receive a glucose monitoring kit before you are discharged and will be instructed on how to use it. Please check your blood glucose and administer insulin as directed in your green insulin card. Regarding the ID bracelet, we have included a pamphlet from which you can order. However, you are welcome to use any company that you wish. Your bracelet should include lung transplant and have the emergency contact information. When you look at your binder under the yellow tab marked monitoring, you will see several gold sheets that contain grids. These are the vital signs that we need you to monitor at the times designated. This includes daily morning weights, twice per day blood pressure, heart rate, temperature, and finally, blood glucose checks as instructed. Again, you will be doing this monitoring frequently in the first several weeks to months after discharge, but this will taper down over time. At the bottom of the gold sheets, there are parameters. If your vital signs are outside of these limits, please call your nurse coordinator at the listed number. As you know, you will be seen in clinic weekly. Please bring your gold vital sign sheets to clinic so you can review your information with the physicians, nurses, pharmacists, and dietitians. If needed, we will make changes to your medication regimen. Being vigilant about new signs and symptoms and changes in your vital signs will help you be proactive in maintaining the health of your new lungs. Like you, we at UCSF take great care to make sure the lungs are functioning in the best possible way. We have a surveillance program which involves 4 key elements to ensuring your best health. And like we previously discussed, this program is more intensive early after transplant, but tapers down over time. The 4 components of our program include the following. Number 1, regularly scheduled clinic visits where you will meet with physicians, nurses, pharmacists, and dietitians. Number 2, CT scans. Number 3, spirometry, aka breathing tests. Number 4, surveillance bronchoscopy with tissue biopsy. For number 1, the clinic visits, there's nothing special you need to do. Make sure your gold monitoring sheets are complete, and throughout each week, write down the questions that arise. You will have an opportunity to get these questions answered. Number 2, for the CT scans, there's also nothing special you need to do. Arrive at your scheduled time and proceed with the CT scan. Generally, no IVs are placed and no dye is needed. It is a quick study, and most of you have already experienced what this entails. Number 3, for the spirometry, you will proceed with your scheduled time. Often, these tests are done as a drop-in test in the same area and at the same time as your clinic visit. You will be taken to the testing room and the technician will complete the exam. Occasionally, these tests are scheduled in the pulmonary function lab on the 13th floor of the main hospital, but again, refer to your appointment schedule for details. Finally, we arrive at the bronchoscopy and biopsy. By this point, all of you will have experienced bronchoscopies that were done at your bedside. At UCSF, we use a surveillance program where we periodically take tissue samples and look for rejection with our pathologists. The reason is because that there are times when low-level rejection can be occurring and patients are not symptomatic. We like to be proactive and intervene early when we can. These bronchoscopies will always be done at UCSF. From the time of transplant, we perform this procedure at the following intervals: at 2 weeks, 4 weeks, 8 weeks, and 12 weeks, then 6, 12, 18, and 24 months after transplant. After that, we do not regularly schedule these bronchoscopies. However, we will perform these biopsies if you become symptomatic at any point. There are some key points that you will need to adhere to for this procedure, and I will go through them in detail. Firstly, the bronch will always be done on the 3rd floor at UCSF. It is similar to your other bronchs, except it will be a slightly longer procedure. You will receive very light sedation, and as a result, you must always have a driver available to take you home. If you do not, we will have to admit you to the hospital for 24 hours. Next, you should not eat or drink anything after midnight the day of your procedure. However, in the morning, you should take your immunosuppressant medications with a few sips of water. If you are on a blood thinner, such as warfarin or enoxaparin, please discuss with your doctor or nurse coordinator the appropriate time to stop these medications. After the procedure, you will be taken to the recovery room for a short period. After about 1.5 hours, you should be able to eat and drink normally. A slight fever is sometimes common, as is coughing up a small amount of blood-tinged sputum. However, if you have a fever more than 100.5, or if you are coughing up bright red blood, you need to either seek immediate medical attention or call your nurse coordinator. Other symptoms that would necessitate immediate care would include shortness of breath, chest pain, or desaturation. In conclusion, we all have a part to play in monitoring the health of your new lungs. By staying vigilant and committed to early recognition and intervention, we expect to keep these lungs as healthy as possible.
Welcome to the last module of our education session. Now that you've received your transplant, we want you to go and enjoy your new life to the maximum potential. Whether that's spending more time with your family, returning to work, or just enjoying life, we want you to find your happiness. Now and for the rest of your life, you will remain under this umbrella of being immunosuppressed. With that comes certain precautions that you must take to prevent illness. We expect that you will go back to enjoying the things that you love, but it must all be done under this new umbrella of being a lung transplant recipient. We've chosen a few specific categories to explore, but if you have other specific questions, please do not hesitate to ask during any clinic visit. Exercise. Over the next several weeks, walking is the best exercise you can do. There is no limit to how much you can walk, but rather than 1 or 2 long walks per day, it's advisable to break it down to 3 or 4 shorter walks. With time, you will be able to return to more vigorous activities such as running, cycling, swimming, tennis, or yoga. But before proceeding with those, please make sure you have clearance from our team. During the surgery, your breastbone was divided. It has been wired back together, but it will not fully heal for about 6 to 8 weeks. Please avoid any activity that puts strain or pressure on your breastbone so as to avoid dislodgement. Your physical therapist will give you specific recommendations on what activities to avoid. Sexual activity. In general, you will be able to return to sexual activity, but like the above, you need to wait about 6 to 8 weeks until your breastbone is healed. Avoid any positions that place pressure on your sternum. Sun exposure. Now that you're immunosuppressed, you are at risk for certain types of skin cancer. It is imperative that you take every precaution to protect yourself. This does not mean you need to live inside. It only means you must be conscientious about your sun exposure. Always, always wear UVA and UVB spectrum sunscreen that is 50 SPF or above. Reapply frequently with special attention to sensitive areas, such as your face, ears, scalp, nose, and forehead. Wear protective clothing such as wide-brimmed hats, long sleeves, and even SPF clothing. Examine your body on a regular basis for changes in moles, new spots, or changes in skin color. As we'll talk about, you will see a dermatologist every 6 months for a detailed skin examination. Travel. Generally, we restrict travel to within California for the first 6 to 12 months after you fully recover. Always check with the team prior to making any travel plans. When you do travel, there are several guidelines we recommend. Always stay in reputable places. Plan to use bottled water. Always carry more medication than you anticipate using, and never check your medication in your luggage. Be sure to carry your medication with you always, whether that be on a bus, plane, train, boat, etc. Finally, prepare for the unexpected. Find out where the nearest transplant center hospital is in relation to your travel destination. If you get caught in an unforeseen situation, it is advisable that you visit the local transplant center. They will be able to easily communicate with our team for further recommendations and plans. Driving. No driving for the first 6 to 8 weeks after transplant. Again, this is related to the healing of your sternum. As an added measure, we ask that you do not sit in the front seat of the car for the same period of time. A deployed airbag can cause serious injury to your sternum. Alcohol. We restrict alcohol use for the first 6 months. Thereafter, it is okay to have an occasional drink, but drinking on a regular basis is not advised. The basis behind this is that there are many interactions between your medications and alcohol. Routine medical screening. As you complete your allotted time in the San Francisco area, you will begin to transition back home. We expect that you will strengthen the network of healthcare providers you have. We rely on them to help us maintain the health of your lungs. Please establish your relationship with your primary care provider. We will rely on their office for routine medical screening, healthcare maintenance, and vaccines. Visit your dentist every 6 months. You will need to see an ophthalmologist every 6 months for a dilated eye exam. As noted above, you will be seeing a dermatologist every 6 months. You will continue to get colonoscopies as per your usual schedule. Vaccines. Once you are 6 months out from transplant, you will need your influenza vaccine. You may never receive live vaccines. If your family receives live vaccines, such as the flu mist, they cannot have contact with you for 2 weeks. Finally, you will need your pneumonia vaccine every 5 years.
This brings us to the end of our lung transplant education session. We made the guidelines presented in these videos as detailed as possible, but there are always topics and situations that are beyond the scope of what was discussed. You always have access to the lung transplant team who will work to ensure all of your questions are answered. We hope you have found these videos useful. Please continue to utilize your binder as a resource. Congratulations on your transplant. We wish you all the luck and success as you move forward with your new life.